Okay. Hi, everyone. This is Tracy, the president of our Alaska chapter of HPNA with our Stories from the Field series. Today, we are very lucky to have Beth Hesse, an ICU RN at Alaska Native Medical Center, who is also a critical care certified nurse and a hospice palliative care certified nurse. And she's here to chat with us about her view on nursing in the time of COVID. So welcome, Beth.
Thank you very much for having me.
Hi everyone, I'm Janine. I am the Secretary and Membership Chair for AKHPNA. And yes, we're so happy to have you here today, Beth. Our first question is, what motivated you to practice in hospice and palliative care?
Yes, well, thank you for the question. I feel like most nurses are driven to where they need to go based on personal and professional experience. And that's really what drew me closer to palliative care. More personal, though, was when I was in nursing school. My mother was very ill and she had multi-organ failure and was actually admitted to an ICU. That ICU was about, a 90-minute drive from my house. So after school, after my lectures, I would drive through LA traffic to be at my mom's side. And it was during this time, being a new student and being inquisitive, that I really absorbed everything around me, almost painstakingly so, where I was so attentive. I was that family member that had the notepad, just taking notes, really watching the nurses. And I was really able to see things that I felt like could be improved or things that were missed, as well as the great nurses that I saw and the care they delivered. But it was an emotional roller coaster for me, like it is for most people, most family members and patients within the critical care environment. And I was 20 years old at the time, so it was very, very challenging at that time. In hindsight, though, I feel like what made this experience most difficult and ultimately pushed me to where I need to be today was communication. As I would see nurses change shifts and providers end their week on, I was constantly met with new providers, new nurses, new agendas, new ideas that people had for my mother. And the communication was just so inconsistent. And it was from day to day, or even on the same day, I would have a provider come in who would be overtly optimistic, which I love to hear, right? Most people want to hear good news. But I would hear this wonderful news that your mom's going to be fine. She's not going to have any issues. She's going to survive this, and her survivability will look exactly like the day before she came into the hospital. And then you have the night shift doc come on, same day, and he would be like, I'm really worried about your mom. I think she's going to die. We've tried everything. We need to stop all interventions. And so during that time, it was confusing. That was part of the emotional roller coaster of just hearing the complete contrast of, she's going to live and she's going to die. It was just very confusing. Communication, as I learned, as I've become a nurse and as I've grown, personally and professionally, is both verbal and nonverbal. During that time when I was at my mom's side, I've never had someone sit down with me or explain things to me or ask how I was. No one inquired about who my mother was. And, what was important to her and what worries and hopes were for the family. Sorry.
And that's okay.
So it was a very, ICU itself is it's a very cold environment. Sometimes it could be paternalistic. Sometimes it could be dehumanizing. And, really wasn't until I made the decision to, liberate my mom from the machines that people started seeing me for who I was and her for who she was. And so through those lessons, I've learned a lot. It was challenging and it was terrible. But ultimately, it pushed me to be the nurse I wanted to be, if not for myself, but for those that I serve. And so that was all my personal experience that pushed me into palliative care. I never knew what palliative care was, but professionally, I knew I can do better. I knew I can improve the system, or at least the care that I provided. And, I never appreciated how strong the human body, mind, and spirit was until I started working in ICU. And just seeing what people go through on a day-to-day basis is just, it's incredible. There's so many positive narratives like woven into the ICU journey, but unfortunately the painful ones are really what stuck with me and what lit my fire to change and to get involved with palliative care. And my first priority and my always priority is just having excellent communication, because that changes, even if it's bad news, it changes the course significantly. And so palliative care was never a concept I was familiar with. I knew communication could be better. I knew I wanted to do better, but it wasn't until people started putting me in touch with like-minded individuals. And I have to give a shout out to Dr. Chris Paramali and nurse practitioner Rana Johnson for this. They were just incredible mentors to me. They were both palliative care. They are palliative care practitioners. And so we were able to meet and we collaborated daily. And I was still an ICU nurse full-time, but I would meet with them daily to come up with a nurse-led, nurse-driven palliative care consultative service within the ICU and step-down ICU unit at the Native Hospital. And from there, I grew the program pretty significantly, where I ended up training 8 different bedside nurses in this practice and continued mentorship with all other bedside nurses. And our hopes were to expand it outside the walls of the ICU. But it's through this that I just, I became more aware that palliative care is just synonymous with good care ultimately, and all good care comes from communication. And so this is really what drove me and grew my passion for palliative care and just seeing the benefits that it provides our patients and families.
Thank you, Beth. That is, I think your career and what you've done is such a loving tribute to your mom. And I appreciate so much what you're saying about communication, because sometimes I think hospice and palliative care people perceive it as just end of life care or symptom management, and that communication piece. That's why we feel like HPNA is so, we so much want to reach out to nurses in every area of practice, because that communication piece and those skills are inherent in everything that nurses do. And so they're applicable in every specialty. And so thank you so much for highlighting that. That's lovely.
Thank you.
We can hear your passion through the Zoom walls of how much you care for your patients and how driven you are to take care of them. So I can only imagine what a fierce advocate you were for your mom, and I can see that you're a fierce advocate for your patients. So thank you, Beth.
Thank you.
So the next question is, what do you find the most challenging aspect of your practice right now in the age of COVID?
Yeah, so thank you for that question. There's just been so many different challenges we're faced, and so many, I feel like challenges we never really thought were there before are just being magnified during this time. Just throughout my years in critical care, I've worked in different ICUs throughout the nation. And what I've always seen as being a challenge is the visitation policy within the critical care environment. Most units have very strict, only 2 visitors, 2 family members at a time. Some other institutions have, it's nurse's discretion, meaning that, if the patient's not terribly ill and requiring like frequent interventions, that we allow more families in at the bedside. But I feel like these types of regulations just foster a kind of a distance between families and the medical team, and families between patients and their loved ones. And it has ultimately lasting effects on these loved ones and their patients as we move forward. And so I feel like mostly these visitation guidelines pre-COVID were really nurse focused. So it's just like, what's best for the nurse? How can we best support the nurse and limit the amount of visitors that we have at the bedside? It wasn't as much patient family centered. And so with COVID, it's just even magnifying that even more. And just being, having personal experience of being a loved one, visiting a family member in the ICU, it's awful. It is the worst day of your life every day. And I can only imagine how COVID is just magnifying this. Right now, the visitation policies in most places across the nation is there's no visitors allowed at all. So if your loved one's in ICU, if they're critical, it doesn't matter. You're not coming in to see them. some places don't have the ability to allow them access to the rooms virtually. And so they're just having zero contact at all with their family members who are on life support and aggressive measures. What we're seeing now, and I'm thankful our hospital has a policy in place. If someone is passing away, if they are imminently dying, we do allow a family member in. But even that comes with challenge, because we're only allowing one family member in to be with their loved one. And nurses are the ones, ICU nurses specifically, are the ones who have to tell them, tell this loving family, this sister and brother and child and father, that they cannot come in, and we're only allowing the spouse in. And so it still is very difficult, and we're doing the best we can to support families, with telemedicine and helping them virtually, but it will never take the place of being there holding the hand of your loved one in those moments. And so I feel like this is a huge problem and issue that we're facing. And then, the nurses are being burdened to explain these visitation policies to family and being the ones to tell them you can't come in to see them. We're also unequipped with the actual equipment to provide virtual meetings at bedside, and we're very unequipped with the dialogue to have with families about this, and the training to do so. And so it's just allowing there to be more distress within families and patients. It's already a stressful environment being in the ICU, and we are just seeing that blown out of proportion, or adequately in proportion. Conversations are not happening. So conversations about goals of care and what would be meaningful to patients and families were rarely happening before, and now I would say even less so, which has been a challenge.
Yeah, that's so hard. That really highlights all the different components that we're faced with, and then added on that burden of the bedside nurse, caring compassionately, and then also balancing that emotional toll that it's taking on you. So I definitely hear that. Were there any other things, Janine?
No, I think that
that's a lot.
so beautifully put. Thank you so much, Beth.
Thank you very much for your time.
Thank you, Beth. We were so lucky to have you. Again, if you are interested in more about hospice and palliative care nursing, please join our HPNA chapter. And we look forward to hearing more stories from nurses across the state, and to hear what it's like caring for anyone of any serious illness at this time.
That's wonderful. Thank you so much for your time.
Thanks, Beth.
Bye.